And World Health Day is marked on April 7 every year to mark the founding of the World Health Organization. As Ghana joins in marking the day, HelpAge Ghana wants specific measures to be put in place to improve access to appropriate and adequate healthcare services for all, especially the poor and older people in Ghana. And we have been joined in the studio by Ebenezer Ajete-Sose, Executive Director of HelpAge Ghana. Thank you very much for joining us. And what does today in particular mean to the HelpAge Ghana?
Yeah, today...
It's obvious that you are interested in certain those who are older.
Yeah, we normally use a day like this to call for national action on specific issues which affect older people in the area of healthcare. So that is the significance of the day to HelpAge. Of course, the international theme is on food security, but we are using it to call for improved access and appropriate healthcare services for our older people.
Okay. What specific measures, you talk of measures that you want to improve healthcare of older persons? What specific measures?
The first one is to look at the issue of geriatrics as a special area of care for our older people. Like we have trained medical staff for children, we also have a similar one for older people we call geriatrics.
Sure.
Unfortunately, Ghana is yet to train medical staff for that. So self-report normally indicates that many of the health challenges that are presented to health officials by older people are normally described as old age, as if old age is a disease. You get there and you start and they tell you, forget it, this is old age. And that can be corrected. We are also suggesting that the National Health Insurance should then take on geriatric health care on board. And that means that we need to take advantage of Section 30, Subsection 3, and Subsection 1 of the National Health Insurance, which actually requests that every 6 months, the disease and drug coverage under the National Health Insurance should be reviewed.
Yeah.
And then also recommendation made to the minister to approve for implementation. And we think if we start taking gradually, even if every year one disease, which normally affects older people, gradually will get there. And of course, to do this, then we need to disaggregate national health data to include older people, because this is very difficult now to disaggregate at the national level, not at the clinic level, but at the national level. As the data goes up, the age indicators get lost. And that makes planning very, very difficult. The next one is about the reduction of the exemption age from 70 to 60 years.
Sure.
In this country, we now have a national aging policy, even though it is yet to be implemented, approved by Cabinet in 2010, which defines an older person as anybody who is 60 years and above. The same definition goes with the UN. We have an average life expectancy at 63. So why then take exemption to 70 years? On paper, it gives the indication that we are not prepared to take out the living. And we are thinking that that should come down. Especially also when this has to do with poverty at old age. Many older people actually find it difficult to make ends meet as they reach that bracket. Also in a country where less than 1/4 of older people are pensioners, it makes life quite difficult at old age, and we think we must come down to help older people in that respect.
Working with them, what are the most common diseases that you think that the National Health Insurance should probably take under its umbrella?
It has to do more with the non-communicable diseases. We're talking especially about the ENT. Eye care is one of the big issues. And we think if the National Health Insurance can expand to include spectacles, the hearing aids, at least the minimum standard to start with, it will help a lot to make older people participate more effectively in society. It will be difficult if you don't see, you can't hear. I mean, you are cut off totally. And this is one area we think the National Health Insurance should be looking at. We are also now seeing cancer, especially for women. We think it is time we start looking at these things.
Right. We'll go on the phone line and speak to the communications manager of the National Health Insurance Authority. I mean, just to get its view, to get the National Health's view on what the Help Age Ghana is saying whilst we go on. But have you made this proposal known to them? Have you? Do you have discussions with the National Health Insurance Authority?
We've made this proposal once through the Ministry of Health about 3 years ago. About 2 years ago, we made a proposal through the Ghana Health Service, and we've booked an appointment to revisit. And last year, we made a proposal again through the Ministry of Gender, Children, and Social Protection, because it is the sector ministry.
Okay.
We are yet to meet the National Health Insurance as an institution.
What's been the general posture?
Officialdom is receptive of the proposal. To us, it is the actions we're looking for. We believe we'll get something more positive from the Ghana Health Service, especially when in 2013, with support from the WHO, we have the first national scale-up plan on aging and health, which was based on the national research. And we believe it takes on board many of the issues we are raising, and we believe the Ghana Health Service and the Ministry of Health should be able.
All right, we'll be joined on the phone line by the communications manager of the National Health Insurance Authority, Salom Adonu. Good afternoon to you, and thank you very much for joining us.
Hi, good afternoon.
Right, first of all, are you aware the concerns being raised by Help Age Ghana on including certain basic or communicable, non-communicable diseases that affect old people?
Well, these concerns have come from a number of quarters in the lifespan of the NHIA, and we've been working so hard on that. And really, if you talk about diseases of the aged, what really are we talking about? We have diseases like hypertension, diabetes, etc., which are very common with the elderly. And these diseases are adequately covered by the NHIA, and a number of other diseases I may not be able to mention offhand to you. They are comprehensively covered in our benefits package. But I think the discussion really has been the talk about, expanding the scope of the benefit package. That is a bigger discussion, because almost everybody is calling for an expansion in the benefit package. When you speak to even people who work with children, they will tell you that the benefit package in respect of children should be expanded. So it is a general, call, which I think the people advocating for aged people's diseases to be expanded are also engaging in. But, at a very general and at a very ample level, we cover diseases which affect generally the elderly, yes.
Well, he talked, the director mentioned giving them hearing aid, their eyes. Those are also very common.
Well, the scheme itself does not provide some of these aids, prostheses, hearing aids, etc. We may give you the care, but when it comes to procuring these facilities, you may have to do that yourself. Of course, it is a discussion. The scheme is growing, so maybe sometime in the near future we may have to consider doing that. So, like I mentioned earlier, it is a general call, irrespective of the category of persons you're dealing with. Like you mentioned, hearing aids. You mentioned optical aids, glasses, and all. There are people who are within the normal bracket, not elderly, not very young people, who also say that the NHIA should be able to cover optical aids and other things. So it's a general thing, a general call for an expansion in the benefit package. But Bridget, I believe that the discussion really should be made broader than we are currently having. We are all directing all needs towards the National Health Insurance Scheme. But what we must also realize is that the National Health Insurance Scheme is not a cash cow. It does not have unlimited resources. I guess recently you've heard in the news that we were calling for resources because the resources we get and the demands of the people, like what the director in your studio is saying, it is difficult the resources we are getting now to meet all these needs. So as we are talking about the NHIS deepening its benefits to the people, we must also be advocating and making Ghanaians know that healthcare is expensive. So if you want to get all the good things that you ask for, you should be able to pay a little more for your health. It could come in the form of taxes. It could come in the form of higher premiums. It could come in the form of anything. So we need to be conscientizing or sensitizing the public on this as well. So you're calling for more services. You should know that NHIS will require more resources to deal with.
But Salom, this in particular, the aged, like one at that age, they are vulnerable. A lot of them are poor. And that's why they are calling for it. It's not necessarily, the national health needs money and all that, but he believes that, they should be given a certain priority.
Well, I get the point, and that is why we cover a lot of diseases for the elderly. But the point I'm making is that it is a call for an expansion in the package or the benefits which we provide to the elderly. The same argument goes for the poor, and the same argument goes for even children, who could also be described as vulnerable. But I think the good news will be that we are engaging in a comprehensive review of the benefit package of the scheme in respect of equitability, amongst other things. So we believe that when these things are concluded, some of these issues will come up, and then some responses may come up as well.
Okay, thank you very much. Salom Adonu is the communications manager for the NHIA. Your response to that? We need broader consultation. There's a lot of talk.
Yeah, we appreciate that, but we still insist that the older people should be looked at. If you look at our statement, we touch on the issue of finance.
Sure.
And one of the challenges is the corruption in the system. Recently, media reports indicate medical staff using the same names which have been used to put in a claim for a private hospital. And this has to do with management. We need to check the system so that the people will stop milking it. And we also need to check people. We started not on a very good note in terms of public awareness.
Sure.
We went around telling everybody that National Health Insurance premium is 7.2, which is actually not true. It is a range between 7.2 and I think around 48. So we ended up getting a lot of people paying 7.2 instead of paying the real actual premium based on their income. And all these, if corrected, will improve the finances of the insurance, National Health Insurance. Another issue has to do with the delay in the release of funds by the Ministry of Finance. If you read the law, one of the sources of income for National Health Insurance is interest on investment. So the earlier we release the money for them to invest and earn interest, the more it can be stretched. So we understand the finances. But I'm telling you, there hasn't been any country which has got enough resources before solving these problems.
All right. Thank you very much. That's actually a very, very fantastic note to end. Thank you very much for joining us.